The University of Maryland Hospital has been a really outstanding player, doing a lot of work with intervention efforts, and we've gotten some additional funding to try and help with that, the Maryland delegation as a whole. But I believe we've got a representative here. The doctor can come up and give some statements about it, because it's really an outstanding program, and I'd love for you all to hear what's happening.
Hello, everyone. Thank you. I am Dr. Bethany Strong. I am a trauma surgeon at University of Maryland Capital Region. I'm also a member of Congressman Ivey's Safe Streets Advisory Board and the medical director for our violence intervention program that is hospital-based entitled CAPTIP. I see some of our participants and also our staff here today, so thank you for coming out as well. CAPTIP was established back in 2017 after a wave of programs realized that solely providing medical care for victims of violence, and more specifically gun violence, was not enough. We could patch up wounds, we could sew up holes, we could even remove organs in some settings, but we would see similar people back again and again, whether it be the exact same person or a similar person in a similar situation. We realized that even as physicians, we had to do more, and we had to address not only the injuries folks were suffering medically and clinically, but psychological injuries, social determinants of health, living situations, employment status. In fact, Dr. Joseph Richardson, who is behind me, was instrumental in starting this program at University of Maryland Capital Region.
And I'm Dr. Joseph Richardson, one of the co-directors of the University of Maryland Progress Initiative. The Progress stands for Prevent Gun Violence, Research, Empowerment Strategies, and Solutions. And I want to focus on those last four pieces of that acronym. We are committed to community-engaged research, which will ultimately translate into empowering the community to reduce gun violence.
That they are not making deadly choices. What happened at Trombo's Park during Senior Skip Day could have been a true tragedy for those who were the victims. But it is also a tragedy for those who are now charged as adults facing very severe consequences.
The County Council takes gun violence very seriously. We have a couple of work groups right now. One is on truancy reduction and one is on gun violence reduction. And I think those two issues end up working together because, after all, it was Senior Skip Day. And it's a day that's supposed to be fun, really. It's going to be hard next year for the next group of young people. When that day rolls around, I think parents are really going to think twice before they willingly let their kids participate.
Where's your common sense? Where is it? You know what? We keep going. We keep going. The Surgeon General, what did the Surgeon General do this week? What did he say about gun violence? Didn't he say that it was a health crisis? He labeled it a health crisis. So, what is it you all need to do? Back these organizations up.
The Maryland delegation has helped to bring back $2 million to the county, roughly. That's going to be used by the state's attorney's office for efforts that they've got underway. Also the University of Maryland, the hospital, the intervention prevention programs that they've got going there. There's a lot of them that have turned that tragedy into a triumph and the pain into power. But however you want to do it or however you want to go about it, we need your involvement. We need your story. We need the experience and the impact that you can bring.